staggering. 117 million adults in our country are chronically ill. Nearly 60% of Americans are now using prescription meds. It's the highest number ever, and it's leading to a growing backlash. Physicians and patients seeking alternatives and getting healthier for it. Here's a look at the new medicine. Carol Peterson is rehabbing from her latest injury, a torn tendon in her elbow.
Right now we're doing some ART to release some of the scar tissue.
ART and PRP have kept her out of the OR. PRP, or platelet-rich plasma, was harvested from her own blood, spun, and re-injected into her injury site. Physical therapy, including active release technique or physically manipulating her tissue as part of her rehab, got her back to full mobility, all instead of costly and time-consuming surgery and recovery.
I have avoided surgery because of this practice.
Peterson, part of a growing group of patients seeking out this brand of new medicine. From runners and triathletes, weekend warriors, or just an aging population opting out of drugs and surgery and in to the healing practices that often boost the body's own healing mechanisms.
Hi, how are you, Evan?
Dr. Sonali Lal is a regenerative medicine specialist.
Most of these patients have tried traditional physical therapy, cortisone injections, hyaluronic acid, and they're just one step away from surgery. 90% of our musculoskeletal cases don't require surgery.
Instead, Lal uses injections of plasma, even stem cells harvested from a patient's fat or bone marrow, and very little pain medicine. Instead,
we give patients IV magnesium if they come in with a headache or migraines. We use a lot of curcumin, which is a natural anti-inflammatory, is equivalent to any NSAID. Medical marijuana has been great for our practice.
the team using gentle, non-weight-bearing Pilates for rehabbing bodies, even meditation, which a recent study has shown to be a far more effective strategy for treating pain.
They can get the same outcome, it's just time is the difference. They get more time back.
Okay, now on to the next challenge, paying for it. Some insurance plans cover, others do not, but doctors say that they're appealing these denials of coverage and winning. So have that money talk with your doctor to see if these therapies are right for you and if they're paid for. Because
so much of this alternative medicine is the right way to go sometimes, but you can't pay for it.
More
it's
and
super
more
expensive.
you're seeing these insurance companies coming on board because they recognize that it's a better rehab, it can be a faster rehab, and it doesn't have the complications of surgery that can have, and then you don't have all the prescription drug costs too.
All right, next, can you do a piece on tackling nausea? Because I am always nauseous. I need to figure out
You're
that.
always nauseous.
Yeah.
I'm gonna,
Doctor?
Yes, I'm gonna get to the bottom of this, Dan.
Dr. Cole.